Hello, Dr. Jigyansa Ipsita, ma'am. Hi. Uh,
Hi, bro.
just for our viewers, I want to give a disclaimer. She is my sister, but including that, she is also MD, DNB Psychiatry, PDF Child Psychiatry. So she is a child psychiatry specialist, and I'm nothing. So I have to. I'm just an IT. Uh, Employee. So I have to ask, what does the PDF mean? Like that was quite confusing for me.
Well, dear brother, it's not that you are nothing. You have done a lot of technical courses and you were a very renowned IT software, unless you decided to step out of the job that you're in. So, PDF for me means postdoctorate fellowship in child and adolescent psychiatry. And I understand it's PDF, it's like PDF document for you. Yeah. So, thank you for the brief introduction. I'm glad to be a part of your program.
Yeah. Thanks a lot. Thanks for clarifying it to me. And yes, for the viewers, yes, previously my sister has already clarified it to me, but just for my viewers, I had to ask this question. But going forward, the questions that I'm going to ask is not scripted, or it is just from an, I think, a common man to a specialized doctor in psychiatry. So going forward, I have already noted down my question from your, just from your LinkedIn profile. I haven't gone through all of your papers that you have submitted to medical institutes. I have not gone through that. Just from the LinkedIn profile, I'm going to ask. So my first question is, uh, what is addiction?
A very tricky question indeed to be the first one. So, addiction, I would say, is a brain disorder where the biological reward system um, is hijacked by dopamine, and dopamine is released by all the addictive substances. I'll simplify it for all your viewers because I understand there were some technical terms that were used. So, what happens in everyday life, whatever we do, whatever gives us pleasure, is through the dopamine. So, dopamine gets released in our pleasure pathway or the reward pathway, and it gives you that kick, that high that you feel doing anything that makes you happy. So what happens is when you're exposed to a substance that releases a lot of dopamine, like all the addictive substances do. For example, be it smoking, the nicotine, or be it alcohol, be it opioids, be it any of the addictive substances, it releases a massive amount of dopamine in your brain, which is like 50 to 100 or 500 times sometimes. That is released by addictive activities. So that amount of dopamine, the brain is like, oh my God, what's this? And then the brain is slowly, you know, suddenly becomes extremely alert, extremely happy, and it starts seeking for that substance more and more. So it depends on what kind of substance that you have taken is the level of anticipation that you have for the next dose. So it also depends on a lot of vulnerability that you have that makes you prone for addiction. So when we talk about addiction, it is actually that circuit of the reward circuit is completely changed or hijacked by the substance. You do not feel like doing anything else apart from the substance. You do not feel like going to school, going to college, going to work. You start missing on family functions, you stop attending birthdays, and you start attending only those functions where there is a substance. So that is how addiction controls your entire life and your functioning. So before people even realize they are under the complete, our brains are completely hijacked by the substance. So that is when we say it is addiction. Yeah.
Okay, I got it. I'll revert to you in my following questions. But for now, my second question is going to be, can you hear me, ma'am?
Yeah, yeah, sure. Please go ahead.
Um, so you're a child psychiatrist, and also you also are a psychiatrist for the adults. So as per me, as per a common man, I can say myself as a common man. So in general, how do you like, because in my terms, someone from the childhood can be uh, very much uh, genius,
Mature?
genius,
Gene.
true. Mature, genius, yes. And for a adult, they can be very much uh, innocent, like childish. So how do you differentiate that?
So we go by WHO, that is the World Health Organization. It has a criteria, very clear. Above 18, you are an adult. Below 18, you're a child. So that's very clear there. But the sensitive question that you're asking about I think it's about the mental age, or how much mature we are in terms of our mental capacity. So, when we see children or adolescents for that matter, particularly if they have a developmental issue in hand, for example, a person may be around 22 years old, but the brain might have matured maybe only 50% of what it is expected to be. So, they might be just mental age of 11 when they actually have a body of 22. So, in those cases, we do have to treat them as an adult for medical purposes, because they are obviously physically the body has matured to an adulthood, but yes, the mental capacity still remains as a child. So maybe developmentally they are still struggling with maybe making friends, or maybe even before that, just separating from their mother, they might have issues around it. So depending on the mental development, their mental health issues can be different, and we do address that in terms of talking about the neurodevelopmental delay, or what is the mental age, if there is a developmental disability. We treat that with sensitivity and with specifiers, but physically we have to treat them as an adult. So it's like a dual situation in the same person sometimes. So yes, I hope you answered that question.
Uh, yes, as per normal, we do not have much time, so sorry for that. But
Okay.
maybe just a silly question.
Okay.
We do not have much time. I think we have only 5 minutes left for this conversation. So, a silly question. Have you watched the movie Accountant and the sequel which came out this year, Accountant 2? In
Sorry, I didn't get the chance to.
yeah, in there is a particular person who is like who do not want to be touched, like uh, or who is unable to or incapable to talk to someone uh, perfectly. But when you play a game of chess with him, he always wins. So how do you differentiate between a genius and someone who is not mentally challenged?
Okay. So I think I would like to answer the question in two parts.
Okay,
So when we are
just,
talking
just
about,
just one more. I would like to, because I liked the movie, so I would like to add the most person avoided came to become the head of a particular institute which only trains genius people who are, yes, kind of like who do not want to be touched, or those kind of people. Like they are society wise they are like neglected because they are very, I do not know the word, but yes, they are sideways. But this particular institute provided the psychiatric help to help them grow and resolve multiple countries' issues. So, in that perspective, how do you differentiate if he is a genius or if he is a mentally challenged person?
So I would like to answer the question in two parts. First, when we're talking about a genius, so we're talking about the intellectual capacity, which is defined by the IQ or the intelligence quotient. So, intelligent percent is what is the capacity of the person intellectually to perform, and that can range from like very low to 90 to 110 is the normal range, and beyond 110 is a high IQ. And usually, when we talk about geniuses, the IQ is beyond 130. So they may be particularly gifted in a particular domain of life. So I have not seen an accountant, but usually in our clinical practice, when we see patients who have sensory issues, possibly, like not touching someone, difficulty in social communication, difficulty in interacting, so they fall under a spectrum of disorders called autism. So autism is a condition where they have difficulty in communicating socially. They have very restricted repertoire of interest. At the same time, some of them are gifted. When we talk about gifted, they may have extraordinary genius-like abilities in a particular domain. So we have a lot of Nobel laureates in our uh, in the in the world who maybe have been in the spectrum, but at the same time they have contributed to science significantly. So we do not say they are mentally challenged because there is a new term for that, and it is called uh, being neurodevelopmentally diverse. Then do not specifically fit in the neurotypical background as we expect them to be in the society as per the societal norms. That is why they're not typical. So they belong to the atypical or neuroatypicals. And that is called the neurodiverse spectrum, where autism is one of the conditions and where we can have people who have genius-like abilities or what we say as savant abilities. I knew a child who was just 7 years old, but at the same time, he could say, suppose I asked him in 2031 on 5th February, what was the day? And he was able to say me in a second without having a glance at the calendar. So they can have that extraordinary ability. So we do not say they are challenged because definitely they have magnanimous capacity, but yes, they face situations like school bullying, victimization, being thrown out of regular schools because our society and system is not equipped enough to maybe give them enough opportunities to display their talents. That is where is the role of inclusivity and maybe accountant and the school that you're talking about is particularly um, willing to contribute in that field.
Okay. I think we are just about time. We just have 1 minute left.
Okay.
So, any last statement that you would like to deliver to our new audience?
I think mental health matters. I would like to congratulate my brother in venturing into this journey of sharing knowledge through this platform. And I wish him a lot of best wishes for his future. So, yeah, thank you so much.
Okay, so you are still short of time. We still have 1 more minute. 1:30 was the last time. What is the difference between autism and some other form? Please respond in 30 seconds.
So we have different domains of development. It can
30
be speech and language, it can be communication, it can be motor, it can be cognitive functioning. If all the four are impaired, it is usually a condition where the global developmental delay happens. It happens usually in the case of intellectually developmental disorder. That is a condition. When that is there, plus there is a differential delay, there is a lot of more abnormality in terms of how you socially communicate, or the IQ is normal, but you have difficulty making friends and all. So that can be autism. So autism is primarily about the social communication deficits in relating to people, connecting people, sharing emotions, understanding other people, and having difficulties when we say autism. And the other developmental disorders have to do with other domains of development. Yeah, 30 seconds.
Okay, great. Let's meet another time with a new topic which you will be surprised of.
Sure. Thank you so much. Bye bye. Have a good day. Take care.
Thank you. Bye bye.